We agreed on one word, and that is unacceptable. Thank you. Madam Chair?
Senator Lujan.
Thank you, Madam Chair. Now, as New Mexico continues to battle the COVID-19 pandemic, we are now also battling the largest wildfires the state has ever seen. Wildfires that were started as a controlled burn by the federal government, and 2 fires that got out of control. So while I very much respect that people keep telling me 99.8% of controlled burns are always under control, I'm more interested in the 0.2% that destroyed our state. These dual crises have stretched the resources of the state to the breaking point. As New Mexicans flee natural disaster, in many cases taking only the belongings they can carry, they face increased exposure to COVID-19 virus, which has run rampant in the congregate settings being used to house evacuees. Assistant Secretary O'Connell, how are you coordinating to support New Mexico's COVID-19 response in light of the wildfires?
Thank you, Senator Lujan, and we continue to keep the people of New Mexico who are currently experiencing these 2 tragedies in our minds. The Secretary on May 9th, realizing the extent of what was happening in New Mexico, declared a public health emergency, and that public health emergency freed up flexibilities for the healthcare system there in order to respond in the emergent condition, including providing telehealth for Medicare beneficiaries, freezing the Medicaid rolls so no one would lose insurance during this time of tragedy. At ASPR, we continue to support through our hospital preparedness program, New Mexico's coalition, healthcare coalition, which was responsible for evacuating many of the hospitals and long-term care facilities, nursing homes. And so we continue to work closely with our colleagues there to make sure that everybody is safe and accounted for. We also run the Medical Reserve Corps, and the Medical Reserve Corps in New Mexico has been activated in order to respond to the wildfires. So we continue to support our colleagues out there through that effort. And we've been in close contact with FEMA. We've offered virtual support to FEMA out in New Mexico. And wherever we can be helpful, we are trying to be. And we've not stopped our COVID response. We're continuing to make vaccines and therapeutics and tests available to those in New Mexico that need them.
And Assistant Secretary O'Connell, this is a follow-up to the solid answer with programs that have been made available. The follow-up is, how is HHS ensuring that these resources are being communicated to those impacted, especially given the current lack of cellular and broadband service in many regions of the state, which is non-existent in these communities?
Thank you, Senator. So we continue to have boots on the ground in New Mexico. We've got regional emergency coordinators in the state that continue to communicate with city and local leaders. We also have our CMS representatives who are making sure that the Medicare and Medicaid provisions are being well communicated to those beneficiaries, and everything we can. We've got several regional representatives leading this effort for us in New Mexico and continue to rely on their ability to communicate on the ground.
Now, I said earlier that many families were forced to evacuate. They were living in congregate settings, but they were not eligible for the 4th COVID-19 vaccine. Dr. Walensky, will you commit to reconsidering CDC guidelines for the 4th COVID-19 shot to account for the risks of people fleeing from natural disasters who are forced into compact living conditions?
Thank you, Senator Lujan, and let me add my support and strength to the people of New Mexico who are experiencing these natural disasters. Maybe if I could just back up and let you know some of the things that CDC has been doing, in including drafting recommendations and documents like wildfire smoke and COVID-19, public health strategies to reduce exposure to wildfire smoke during the COVID-19 pandemic, going to a public disaster shelter during COVID-19. We have documents. We're providing technical assistance on the ground, as well as public health communication, exposure assessment, and epidemiologic data in order to support the efforts ongoing there. And we've been working in our National Center for Environmental Health over the last decade to support health departments to prepare for, respond to, and recover from wildfire disasters. Specifically to your question about booster shots for this population, CDC is committed to continuously reviewing the data on the safety and efficacy and need for booster shots. We do so all the time. time. We strengthened our recommendation for those for a fourth shot for those over the age of 50. And should we see a need, safety, and efficacy, we will continue to expand, but we certainly want to follow the data as we do so.
I appreciate that, Dr. Walensky. And Madam Chair, as my time expires, I still have a couple of questions I'll submit into the record. But I'm hoping that that's a long way of saying yes definitively to making these changes. Not all of us are over 50. There were a lot of, and I just turned 50, so I can say that now. There are a lot of young families and children and grandchildren who are in these settings above the age of 5, where we had them all in one place. And when we would get scares of spread or those that had tested positive, it's a perfect place to help provide additional support in a community where it's hard to get to, and we don't always have the availability. So this is an area that I will continue to push, and I'm hopeful we can find a positive remedy here, because New Mexico is not going to be the only state facing natural disasters. We're in that season right now. And so I'm hopeful that there will be some positive direction in how we can take care of more people. I thank you very much, and Madam Chair, I yield back.
Senator Cassidy.
Thank you all for being here. Thank you for your efforts on part of our country. And of course, what we're